Well, it's a fact of life that your vision changes as you get older.
Knowing what to expect and when to seek help are important steps to protecting your vision.
UW Health is hosting a free sight-saving symposium on October 8th, and Dr. Barb Blodi from the UW Department of Ophthalmology is here. Welcome to Live at
Welcome.
5.
Thank you.
What are we talking about here?
Well, we're talking about two major eye diseases that can cause blindness both in young and old people. Macular degeneration generally affects people over 60, but the problems that occur in both conditions can affect the center of the vision, where they can lose vision and get severe distortion because of the underlying problems with those two diseases.
What is the other disease? Macular degeneration
and diabetic eye disease.
Okay,
diabetic
so is that someone who has diagnosed diabetes or someone who just has high blood sugar in general?
Typically, the patients come to us after the diagnosis of diabetes. It can be type 1 or type 2 that leads to eye problems. Sometimes the eye doctor can make the diagnosis of diabetes. That can happen as well.
Oh, interesting.
So besides diabetics, are other people at risk?
For the diabetic eye disease, you have to have the underlying diabetes.
But for the degeneration?
And the macular degeneration is a separate condition, so those two are not related, but macular degeneration affects older folks, generally over 60.
Do any of these conditions present symptoms? Isn't one of the things that's so difficult about them is that by the time you notice you have a problem, it's already quite advanced?
Yes, we do recommend routine checkups. So for patients with diabetes, they need yearly eye exams where the eyes are dilated. For patients that have macular degeneration, it may be found on a routine exam because there are no symptoms, and then we need to follow those patients more closely. So the dry form of macular degeneration may have no symptoms.
Wow. So you recommend that people get a baseline eyesight reading?
Yes.
When should you do that?
Really, early adulthood is a good time to get that baseline, and then we recommend that after the age of 50, every 2 to 3 years, at 65, every year.
So at the Saving Sight Symposium, what will you be doing at the Alliance Center?
Yes, we'll have some great presentations. I'm really looking forward to this, where in the morning we'll concentrate on macular degeneration. The afternoon will be diabetic eye disease. And we'll talk about current treatment, new research, things that are up and coming, as well as some patient-centered talks where we can tell patients how best to cope with these problems. What are the resources that are available in the clinic? What are the resources in our community?
So there's treatment.
There is treatment. The good news is for macular degeneration and one of the forms of diabetic eye disease, we've had revolutionary treatment by giving some injection of medicine into the eye. It sounds very strange, and it's something that you might not want to sign up for, but it's really led to improvement in vision, something we've never seen before. So patients may need repeated injections, but they come back because they see how effective it is.
So is this an opportunity for people just to learn more information or to actually get their eyes tested?
Yeah, it is only for information. Now, they will be hearing from us and getting information, but we also hear from the patient. So there's opportunity for the patient to ask questions, and we learn a lot from that process, and we hope the patients do too.
What a great opportunity for everyone.
Yes.
Doctor, thanks for being with us today.
Thank you so much.
Nice
I appreciate
to see you.
it.
Have a good weekend.
Appreciate it. Thank you.